Pain, not death, is the enemy of mankind. And after you learn about Prudden Myotherapy, you won't have to live with fear of pain. Hi, I'm Lori Drummond, certified Prudden Myotherapist, and I'm going to show you how to get rid of head, neck, and shoulder pain. To begin with, let me show you some of the tools that we'll use for self-help myotherapy. This is a Bodo. It has a nice dowel and a handle to give you a good hold. You can use your index finger along the dowel to give you control and make it seem more like an extension of your arm. We'll just roll up onto the point, and it makes it a little bit easier to get the trigger points without having to work your hands so hard. This is a Crook. It was designed by people who do myotherapy, so it makes myotherapy easier for you using leverage and the angles of the Crook to do the work for you, so you're not having to muscle it. We'll use both the large curve and the small curve depending on what part of the body we're working on. If you'll notice that the tip is also small, so it makes it more specific for accessing the trigger points. We'll start with the Bodo in the back of your neck, where most headaches come from. If you start by finding your spine, come up to the base of the skull at your spine, slide out. About halfway to your ear, you should find a nice little groove. We'll use that as our guideline. That's where most of these trigger points are hiding. Take your Bodo, come in that groove just under the base of the skull, roll onto the point, press deep, and then angle that Bodo up under the base of your skull. That's about where one of the nasty points will be. When you've got a sensitive point, we're going to hold it for about 7 seconds to diffuse that trigger point. In that same groove, slide about halfway down the neck and roll onto the point of the Bodo again. This time you're aiming towards your Adam's apple. You're going deep into the neck. And there's nothing magical about 7, but that's about how long it takes to diffuse the points. Now we're going to switch to the Crook. Makes it a little easier to get further down. We're going to take that same line, continue it down right about where the top of your shoulder blade would be. Put your Crook down. Let your hand do the work on top of the Crook. Your other hand is going to rest on the small curve and just roll it away from you. Instead of pulling, roll it. Let the angles and leverage work. If you can't find it rolling straight back, tip it a little bit to one side or the other. You can also try tucking your head under or dropping it to the side. Sometimes you have to hunt for them. Now, drop your your Crook over your shoulder. Put your thumb on top of your shoulder, your fingers down by the bottom of your arm, slide halfway between those 2 points and just behind where the shirt sleeve seam would be. Put your Crook down, slide it away from you, a little closer towards the spine on top of that shoulder blade, and roll it away from you. This is a hot spot of trigger points. These muscles are often overworked from stabilizing your arms and working your arms. So these trigger points contribute to any pain going on in your arms, your hands, your shoulder, your neck, and your head. They're very busy. Come up to the top of your shoulder, come on the inside of that bony process, your acromion process, put the Crook down right on the ridge of that muscle. Roll the Crook away from you. Let this arm, weight of the arm do the work. Roll it away and come a little closer to the neck for the next one. Right on that same ridge, roll it away, and we're holding for about 7 seconds. Again, nothing magical about 7. That's about how long it takes. Now go in between those 2 points and closer to the shoulder blade, so you're going a little bit further back on the back edge of that trapezius muscle. These muscles contribute to shoulder tension, neck tension, and of course headaches. Now to give these a little stretch, pull your shoulders up and press down. Pull up, and don't just drop them, go ahead and press them down. We want to stretch those muscles out and remind them to give up their habit of shortening and going into spasm. And tuck your head under. Nice and easy, turn to one side and back to the other. And one side and the other. For the shoulder girdle area, put your arm in front of you, turn under, and stretch out away from you. That will give you a stretch in here. And palm up, relax, turn under and stretch. You want to repeat these exercises at least 4 or 5 times each and about 4 or 5 times a day. We're trying to break a habit and re-educate the muscle to stay at its normal resting, relaxed position. Okay? Now, whenever you have trouble in the front, you have to look for trigger points. Whenever you have trouble in the back, you have to look for trigger points in the front and vice versa because the muscles will pull on each other. Find this rope-like muscle. It starts behind the ear and comes to the notch in the collarbone. If you turn your head to the side, it makes that muscle pop out for you. Put your thumb in front, in back rather, your finger in front. Now turn straight ahead. That muscle will relax. Go ahead and squeeze it. If it's still too tight, tuck your head towards your hand. These trigger points can cause pain in the jaw. Slide halfway down, squeeze again. They can cause ringing in the ear, headaches, pain in the temporalis area, in the temple. And come on up. We'll catch the trigger points around the eye. Put your thumb down above your eyebrow. Slide the skin and the muscle down. Don't press yet, just slide the skin. Roll under that bone and now press up. We're trapping the trigger point. This is a wrap technique. And these trigger points can contribute to headaches behind the eye, but they also contribute to wrinkling in the forehead, so you might want to try these to get rid of that corrugated look from your corrugator muscles when it gets tight. And now come out to the temple. It's a little hollow spot just to the outside of the eye. Go ahead and press straight in. Now this is a 5-point compass, so ease up, slide the skin up, and angle, trap that trigger point against the top edge of that rim of the bone. Ease up, slide down and trap it against the lower edge. It doesn't have to hurt in every place. You're just looking for the points that are sensitive. Come forward towards the eye. Ease up and come to the back. Now the temporalis and the masseter muscle in your jaw are connected. So if you have trigger points here, it can cause jaw pain and vice versa. So grit your teeth. Feel where that muscle is. We're going to come right in the middle of that muscle, press deep, and aim towards your ear. Okay? To stretch this area, turn your head nice and easy to one side. This will get the sternocleidomastoid that we did earlier, and the other. That muscle also contributes to being dizzy, so don't forget that. Okay, these are just a few of the key trigger points. For complete information on Bonnie Prudden Myotherapy, please visit our website at bonnieprudden.com. And as Bonnie would say, keep fit, be happy.